consent to this video.
Alright, so first things first, I'm going to enter the room with my hands washed and all my necessary supplies gathered. I'm going to introduce myself to my patient, say, hi, my name is Toe Coffman, I'll be your student nurse today, and then I'll identify my patient with 2 patient identifiers. So what's your name?
Braden Womack.
And date of birth?
9/18/98.
Alright, perfect. So then I'm going to explain the procedure to Braden. So today we'll be doing a head-to-toe physical assessment, and then I would provide privacy for my patient, whether it be closing the door or closing the curtain, which in this case the door is closed. So then we can go ahead and begin with inspecting the patient's positioning, their appearance. So first of all, the patient is sitting upright and erect. They appear to be well groomed. Their clothes match the weather, and their apparent health, they do appear to be healthy. I don't see any issues just on first glance. So then we will go ahead and move on to their face. They're making eye contact with me. Their facial expressions match their mood and what's going on here. And so then we'll move on to the the level of consciousness and orientation of the patient. So Braden, I'm going to ask you 4 questions. What's your name?
Braden Womack.
And where are you today?
In my house.
And what are we doing?
Physical assessment.
And what time is it approximately?
Like 11 or 10ish, early morning.
Perfect. So Braden is alert and oriented ×4. He knows what's going on around him. He knows what we're doing situationally, and he's aware of what's going on, and he is conscious. So then the next thing we're going to note is Braden's speech. He's been making eye contact with me while he talks to me. He's been very clear and articulate while he's talking to me, and his words match what's going on. So we're all good there. So the next thing we're going to do is go ahead and ask Braden, are you experiencing any pain today?
No.
Alright, perfect. So then we can go ahead and move on into vital signs. So the first vital sign that we're going to take is we're going to do our heart rate. So I'm going to first find Braden's radial pulse. So go ahead and give me on your hands. Alright, so I feel his pulse. It is strong. It's not bounding, it's elastic, and I would grade it a 2+. So because of that, I am going to count it for 30 seconds because it appears to have normal rhythm, and multiply it by 2. So So I counted 40, which multiplied by 2 is 80, which falls within the normal limits of 60 to 100 beats per minute. And the rhythm was regular throughout. So then we can go ahead and move on to breathing. So the first thing I want to notice is Braden is not using any accessory muscles or sitting in tripod position. He is breathing room air. He does not appear to be out of breath or struggling to breathe in any way. So Braden, if I could have you stand up. And I'm going to have you face that way, and I'll have you put your arm on your opposite shoulder so I can assess your breathing, and just go ahead and breathe normally, and I'm going to count for 30 seconds. Alright, so things I want to know is I counted 8 breaths, which multiplied by 2 would be 16 breaths per minute, which falls between our 12 to 20 range. And Braden appeared to have good depth on his breaths, probably about 1.5 inches, which we expect to be 1 to 2 inches. So the next vital sign that we're going to take is going to be blood pressure, so you can go ahead and have a seat again. And the first thing I want to make sure I note is if we have any contradictions on the arm that I'm going to take it on. So I'm going to be taking it on Braden's right arm, so he doesn't have any IVs on this arm or anything else that would prevent us from taking it on this arm. So the next thing I'm going to do is go ahead and measure the blood pressure cuff, make sure it's the right size. So the width should take up about 40% of the arm, which it does, and the bladder should take up about 80% of the arm, which it also does. So this blood pressure cuff is the correct size for our patient. So I'm going to go ahead and first locate the artery. This is the brachial artery, and once I have that located, I am going to go ahead and place the blood pressure cuff 1 to 2 inches above where I found the artery. Alright, and then if I could have you hold this up for me. And Braden, what's your normal blood pressure, do you know?
I think 144 over 80.
Alright, so I'm going to make sure that I inflate it about 30 above his normal blood pressure and take that into consideration. Alright, so for Braden's blood pressure, I got 142 over 88. This would put him in the stage 1 hypertension, which ranges from, or this is hypertension, which goes from 140 to 100 systolic and diastolic. So we would make sure that we wanted to make note of that in the report. So now moving on, we can go ahead and move to our facial part of the assessment. So the first thing I want to notice about Braden's head is it is erect. He doesn't seem to be having any trouble supporting his head, and it is oval in shape. Next, we want to check symmetry with just standing still. So first, his corner of his eyes match up at the top of his ears. His nose and mouth are midline and symmetrical, and his eyes are both evenly distributed. So at rest, his face is symmetrical. So now, Braden, I'm going to ask you to smile and frown and go ahead and puff out your cheeks. All right, perfect. So symmetry is also equal still with movement of the face. So the next test that I'm going to do, Braden, is called Perla, which measures your pupils. So first I'm going to have you look straight ahead. I'm going to measure your pupils. And the first pupil is about 4. And the second is also 4, which falls in between the range of 2 to 6, which is normal findings, and it also shows me that they are both equal. His pupils are also round. The next thing we're going to do is a direct and indirect light test. So Braden, I'm going to have you just look straight ahead. I'm going to shine bright light directly into both eyes. First time I'm going to look directly on the eye that I'm shining it on for constriction, and then for indirect I will check the opposite eye for constriction. Alright, so on both direct and indirect light tests, we see constriction of the pupils, both the one that I'm shining the light into and the opposite eye. So the next thing I'm going to have you do, Braden, we're going to check for accommodation. So I'm going to have you look at the tip of my pen, and both eyes converge, excuse me, and pupils constrict. So he passes all the check boxes on Perla. So the next thing we're going to do is we are going to go ahead and move on to our arm assessment. So the first thing I want to note about Braden's arms is that they appear to be similar in size and length. They're bilateral and symmetrical. I want to note the skin color is a tannish pale with pale undertones. And I do notice one primary lesion here on the left forearm in the form of a mole. That is a primary lesion. It is pinpoint in size, it is circular, and it is singular in distribution. So the next thing I'm going to do is I'm going to go ahead and palpate both arms. I am going to make sure that I get all the arm from top to bottom, including all the joints and the fingers. And Braden, if you have any pain or tenderness throughout this, please let me know. Any pain or tenderness?
Nope.
Okay. Other arm? And any pain or tenderness?
Nope.
Alright, so I don't see physically or feel any signs of edema or fluid buildup in the arms, so we're all good there. The next thing I'm going to do is assess the temperature of both arms. So, using the back of my hands. And both arms down to the hands are the same temperature. They're both warm bilaterally, and as I move down the arms, they do get colder towards the fingers, but this is a normal finding. Alright, so the next thing we're going to go ahead and look at is our chest and thorax region. So Braden, if I could have you stand up and remove your shirt, please. Perfect. Alright, so the first thing I want to notice about the chest is our sternum is midline. Our ribs come in at a 45-degree angle, and he does not appear to be barrel-chested. So then we can go ahead and we can assess his breathing sounds. We're going to do this by doing 10 to 12 spots, both posteriorly and anteriorly. We're going to start above the clavicle, and we're going to go in a pattern in order to ensure that we're assessing the symmetry of the breath sounds. So Braden, I'm also going to end mid-axillary, which is below the arm. So I'm going to have you lift up your arm at some point. So just go ahead and take a deep but normal breath at each position. Alright, and get out of here, lift up your arm. And your other arm. Alright, perfect. So then can I have you turn around? We'll do the same thing again. On the anterior side, all breath sounds were clear, this way, and symmetrical on both sides. So we're going to go ahead and do the same thing, 10 to 12 spots, and ending mid-axillary. So go ahead and take deep breaths again for me, Braden. And go ahead and lift up your arm. And the other arm. Alright, perfect. So on both posterior and anterior breath sounds, both sides were clear and symmetrical. So now we can go ahead and move on to heart sounds. We're going to be assessing 5 heart sounds and their locations. The first one is the aortic heart sound, which is on the right sternal border, and I'm going to go ahead and locate it now, and it is in the second intercostal space. The next one is the pulmonic heart sound, which is the same, just on the other side. So it is on the left sternal border on the second intercostal space. Next is Erb's point, which is the third intercostal space on the left sternal border, excuse me. And then the fourth intercostal space on the left sternal border is the pulmonic heart sound. And then finally, in the fifth intercostal space, mid-clavicular, we have the mitral heart sound. So I'm going to go ahead and listen to all these and discuss my findings. So just breathe normally from your brain and listen to your heart. So I didn't detect any murmurs at Herb's point. I heard good S1 and S2 heart sounds. I heard S1 louder at the apex of the heart and S2 sounds louder at the base of the heart, which are all normal findings and to be expected. And I also heard regular rhythm. So that's all good. Next thing we can go ahead and move on to is the abdominal assessment. So Braden, if I could have you lay down on the bed here. And I will go ahead and drape your upper half for comfort. Alright, so other thing I want to do is I want to make sure all 4 of my quadrants are exposed and visible, which they are. The first thing I want to note is the appearance of the abdomen. It is tan with pale undertones, just like the arms. I do note a primary lesion right here in the upper left quadrant in the form of a mole, which is pinpoint, circular, and singular in distribution. The other thing I want to note is the abdomen is not distended, it is flat, and there don't appear to be any lacerations, ulcerations, or any signs of hernias or other conditions. So the first thing I'm going to do with the abdomen is I'm going to take a listen. I'm going to listen in 2 spots in each quadrant. And I want to ask Braden, do you have any pain anywhere in your abdomen? Alright, perfect. So I'm going to begin in the right lower quadrant. If Braden did have any pain anywhere for listening and for palpation, I would want to begin where I would end in that quadrant. But because he does not have any pain, I will begin in the right lower quadrant. Alright, so throughout the bowel, I heard small clicks and gurgles. It was active bowel sounds, probably about 10 per minute, and no unexpected findings there. The next thing I'm going to do is repeat the same process, just with palpation, using 2 fingers lightly. And Braden, I want you to report any pain or tenderness to me throughout this portion of the exam. So 2 spots per quadrant, using 2 fingers and rolling. And any pain or tenderness there?
No.
Alright, perfect. So then we can go ahead and move on to the legs portion of the assessment. So Braden, I'm just going to roll up your shorts just a little bit so I have full visibility of your legs. The first thing I want to know about the legs, I'm also going to remove your socks, sorry. Alright, so the first thing I want to note about the legs is the skin color. It follows suit with the rest of the body so far. It's tan with pale undertones, not noting any ulcerations or lacerations anywhere on the legs. The hair distribution seems to be even throughout, and there is one very small primary lesion in the form of the mole right above the left kneecap. It is single in distribution, circular, and pinpoint in size. So now I'm going to go ahead and, I also don't notice any vascular lesions or venous patterning in the legs. So then I'm going to go ahead and palpate both legs, starting from the very top, going down all the way to the toes, making sure to get the joints. Be assessing for edema, and Braden, if you feel any pain or tenderness throughout this portion, please let me know. Any pain or tenderness?
No.
Alright, other leg. And any pain or tenderness in that leg. Alright, so I didn't notice any fluid buildup, edema, or as I was doing it, I didn't notice any redness either, so that all checks out. The next thing I'm going to do is I'm going to assess the temperature of both legs using the back of my hands, starting from the very top and going all the way down to the toes. Alright, both sides are equally warm. They do get colder as I go down to the toes, but this is a normal finding. The other thing I want to ask Braden is, Braden, do you have any numbness or tingling in your legs or any of your extremities?
No.
Alright, good. So now we can go ahead and move on to our flexion test. Before I do that though, I do want to make sure one more time to make sure I don't have any ulcers. Paying special attention in between the toes and the heels this time. So no ulcerations on the front side of the legs, between the toes, no cuts or ulcerations as well. Checking the feet and under the heels, and we're good there. So now I'm going to go ahead and assess flexion. So first we're going to do plantar flexion. So Braden, I'm going to put my hands beneath your feet and I'm going to have you push your toes towards the floor. Alright, perfect. Both sides were strong and equal and had good flexion. And now I'll do dorsal. So pull your toes towards your nose. Alright, perfect. Once again, bilateral strength, equal in strength, and no issues there. So now we're going to go ahead and assess the pulse. So first we're going to do the posterior tibialis pulse, which is located on either side, right inside the ankle bone. So once I locate that, alright. I would grade both pulses a 2+. They're both strong, they have regular rhythm, and they're elastic. And then I will also do the the pedis pulse. Can't think of the other word with it, but it's located in between the first two toes on either side. So I'm also going to grade that pulse. Alright. Oh, it's the dorsalis pedis, sorry. And on both sides, they're equal in strength. They're both strong, elastic, and regular rhythm. So I'd grade both of those 2+. Finally, the last thing I want to do is I want to make sure that Braden doesn't have any IVs or prior Foleys or any other medical issues that I need to know about for my assessment, which he does not appear to at this time. And now I can move on to my closing. So I want to make sure Braden's positioned for comfort. I want to do Bix, so the bed's in the lowest position. His personal items are within reach. His call light is within reach, and the side rails are up ×2. I also want to document all my findings from throughout this assessment.